Hello and welcome to our channel. In this video we will discuss about homeopathic heart tonics. So basically in this video we will discuss about the third heart tonic, that is Dr. Reykjavik R3 homeopathy drops for the heart disease treatment. So let's start our today's video, that is Dr. Reykjavik R3 homeopathic drops for heart problems. So Dr. Reykjavik R3 drops is a German homeopathic remedy to treat various symptoms of the heart disease. It primarily increases the muscular strength of the heart, and it's well indicated for the heart weakness with the tendency towards swelling, which is also called as edema, due to the various infections and other cardiac problems like degeneration of the heart disease, which is leading to the weak heart walls, and that is also called as myocardium, attacks, that is cardiac infarction, and the infection of the inner lining of the heart, which is called as endocarditis, low muscle tone resistant to stretch, which is called hypotonia. And this R3 is also indicated for the clots in the heart's arteries, that is coronary sclerosis, heart disturbances due to the faulty digestive system, that is gastro. Now we'll talk about the clinical indications of R3 drop. So this R3 is indicated for the symptoms of the heart disease like heart insufficiencies of a light to medium degree, that is myocardial weakness, in case of valvular heart disease, degenerative processes of the myocardium, angina pectoris, cardiac decompensation, cardiac arrhythmias, coronary insufficiency and endocarditis, gastrocardial syndrome and myocardial insufficiency, and it's very well indicated in case of myocarditis also. So this is a chief clinical indication of this R3 Reykjavik R3 drops, which is meant for heart problems. Now next we'll talk about the composition and the medicinal action of R3 drops. So let's talk about it. So the composition of the R3 drops. So R3 heart drops contain following homeopathic ingredients, or you can say medicines, to treat various symptoms of the heart disease. So it includes Crataegus mother tincture, digitalis D3, kalium carb D3, kalmia D3, phosphorus D5, scilla D2 and spigelia D3, stropanthus D3 and arsenic album D5. So these are the main medicines which are used for making this heart tonic, that is R3 Reykjavik heart drops for heart problems. Now next we'll discuss about the mode of actions of the main ingredients and how they act. So let's talk about the medicines now which are used for making this tonic. So the first medicine which is used for making this tonic is Cactus grandiflorus, is meant for operation with symptoms of angina pectoris, whenever there is strong pulse and there is a feeling of suffocation, or you can say dyspnea. So these are the chief symptoms for using Cactus grandiflorus. Now the second medicine which is used for making this tonic, this heart tonic, is Crataegus. So let's talk about it. So Crataegus work very well on myodegeneration cordis with cardiac weakness, enfeeblement of the heart during various infectious diseases, painful spasms, hypertension, tendency towards decompensation and functional irregularities. Now the third medicine which is used for making R3 heart tonic is digitalis. Digitalis is meant for heart failure with the cardiac dilatations. Now the next medicine that is used for making Dr. Reykjavik R3 heart drop is Kalium carbonicum. So let's talk about it. So Kalium carbonicum is meant for the weakness of the heart and the cardiovascular system in endomyocarditis and whenever there is a sharp pain in the heart. Now the next medicine which is used for making this heart tonic is Calmia. Now let's talk about it. Whenever the pain extends down from the left arm, this medicine is well indicated. It's also useful in chronic heart weakness with difficulty in breathing, or you can say the feeling of dyspnea. There is acute and chronic endocarditis following gout and rheumatism. Now the next medicine which is used for making this heart tonic is phosphorus. Heart palpitations mainly when resting on the left side, a flux of the blood to the chest and suffocation, anguish whenever there is a general nervous exhaustion and hypersensitivity. So these are the key features for using this medicine called phosphorus. Now the next medicine which is used for making this Scylla. Now let's talk about it. Whenever there is an insufficiency of the cardiovascular system with dysrhythmia and whenever there is a decompensation phenomenon, so this medicine acts wonderfully. Now the next medicine which is used for making this tonic is Spizellia. Whenever there is a strong and abnormal palpitations of the heart, whenever there is a low pulse and there is a condition endomyocarditis, so this medicine works wonderfully. It has a chief action upon them. Now the next medicine which is used for making this heart tonic is Strophanthus. Strophanthus is a fast-acting heart tonic. And the last medicine which is used for making this is arsenic album. So these are the various medicines, and this was all about the composition of this Dr. Reykjavik R3 heart tonic drops. Now next we'll talk about the doses, that how to take this medicine. So let's talk about the doses. So according to the weakness of the heart, it has to be taken 3 times daily, that is TDS, 10 to 20 drops of Dr. Reykjavik R3 drops in some water, and in the beginning of the treatment even 4 to 6 times daily. And in case of strong tendency towards hydropsy, it has to be taken undiluted. Improvement should follow after several days only. If not, the dose should be increased and reduced again after improvement to 20 drops 3 times a day. And even after complete disappearance of the complaints, a treatment of 10 to 15 drops 2 to 3 times a day should be continued for a longer period of time. And overdosing presents no danger. There is no side effect in fact. And in acute weakness of the heart, every 15 to 30 minutes. So this was all about. So that's all. In this video we have discussed about the third heart tonic, that is Dr. Reykjavik R3, their composition, their action, and the various medicines which are used for making this heart tonic, and how to take this tonic. We have also discussed about the dose. So that's all. That's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, press the bell icon for more updates. Stay safe, stay healthy, and don't forget to meditate and exercise every day at least for 3 hours. And yes, thanks for watching our video.